The other thing is that we find that the more cycles of moxie you have, the more likely you are to get rid of this culprit that we call MRD, the minimal residual disease, that can cause the hairy cell to come back again if you don't get rid of it. Now, do you remember how many cycles you got of the moxie?
I think it was 4. I think it was 4 periods where I came down here and stayed for 8 days.
Right. My memory is it was 5, but
Okay.
you could be right. It's okay. But basically, we believe that it takes at least 2 cycles, 1 or 2 cycles, to get a complete remission. And then we like to give extra cycles so that we can get rid of that minimal residual disease. So to get a complete remission with hairy cell only requires not being able to see the hairy cell in the bone marrow and the blood by the regular stains, the kind of stains that we've been using for the last 50 years. But the minimal residual disease, as I said before, requires special antibody tests. And so we want to give extra cycles of moxie so that we can get rid of the minimal residual disease that can be detected by those highly specialized tests. And so we were able to give you several of those extra cycles, and so you've now been going on for about 10 years. Is that right? Or eight and a half years?
It was December of 2008. When
2008.
you said
Okay.
it was gone.
Okay, very good. So we're now at about the 10 and a half year time point. So we check patients. This is something that's not absolutely necessary to do in clinical practice, because this is a clinical trial. We're following patients about every 2 years with bone marrow to determine if we've gotten rid of the minimal residual disease. And so far, at least up to a couple years ago, we couldn't find any trace of hairy cells. And so we are very happy about that. There are other patients on the trial, of course, that have had that as well, that have also not had the minimal residual disease. But some patients have had the minimal residual disease. They haven't been able to take as many cycles as you have. Or some people have had as many cycles, but we couldn't get rid of the minimal residual disease. But in any case, most of the patients, fortunately, who got complete remission on the trial are able to get rid of the minimal residual disease. And so we believe that this is an important advanced in hairy cell, that you can get rid of the minimal residual disease without chemotherapy.